Hello there. For those who are new, my name is Aamiya Shetty and I am a member of the M.M.I.O, which is the Misunderstood Mental Illnesses Organization. This YouTube channel is dedicated to explaining certain misunderstood mental illnesses. Remember this as a warning though. I am not a licensed psychologist or professional. Please do not self-diagnose yourself or anyone else. If you feel like you have the symptoms listed in the future videos, please contact a professional at once. Once again, I am not a professional. I am just a student interested in spreading awareness and helping out. Depression. In this episode, I will be talking about and answering these questions. What is depression? What can cause depression? What are the symptoms? What are the treatments available? What are the common misconceptions? And how can we help a person with depression? Once again, in this episode, I will be talking about the interview I had with Miss Shrradha Sidhwani. What is depression? Depression. It is a very common mood disorder and mental illness in India, PTI. According to India Today, India is the most depressed country in the world. Depression is a mood disorder. This disorder affects the mental health of the patient. Depression is also the mental illness that many people know about, but many do not properly understand it. Depression is a mental disorder that makes the patient excessively sad and they feel lonely. Depression is a disorder that makes the patient feel like they are alone and useless. They feel like their presence makes everyone else perform worse, and they feel like they are a burden. Severe depression can lead to negative things. What can cause depression? Depression does not have only one cause. In fact, according to the Healthline, there are 5 possible causes of depression. 1. Genetics. 2. PTSD or past traumas. 3. Other medical illnesses and conditions. 4. Substance abuse. 5. Biologically. Genetics. Depression is also a highly genetic illness. As I said in all the previous episodes, depression can be inherited through families and generations. If a child's parents or grandparents have had or has depression, it is very likely that the child might inherit it from their grandparents. It is actually more likely that the child will inherit the mental disorder from their grandparents rather than their parents. PTSD or past traumas. Sometimes, if a person has gone through something that has either mentally or physically harmed them, they might become depressed. PTSD, which is post traumatic stress disorder, can be caused by a number of reasons. Usually, the after effects of the traumatic incident leave the patient with PTSD and/or depression, especially if the person believes that the trauma was inflicted on them or the surrounding people is their fault. Insomnia is a medical condition where the patient does not sleep or does not get enough sleep on a daily basis. Because of this, it can cause a huge lack of sleep, which could affect one's mood, which could possibly lead to depression because of lack of motivation and lethargy and laziness. Substance abuse. When people overuse drugs and other illegal and harmful substances, it could have negative side effects on the patient, which could result in the cause of mental illnesses like depression, especially when the patient is going through withdrawal. What are the symptoms of depression? The symptoms of depression vary. Most of them are very clear, but a few are hard to detect. These are the symptoms and their explanations. Loss of interest. The patient will lose all or any interest in the activities that they had or are currently partaking in. This means that if the person liked to play sports like football or baseball, they would lose interest in them and opt for other things that require much less energy. They would simply not have enough energy to partake in any strenuous or any activities at all, without it making them feel anxious or tired. Constant feeling of sadness. The patient will constantly feel sad and lonely. During this time or all the other times, the patient or person will feel alone and down. The only few things that they would want to do is stay at home alone and minimize their contact with the outside, and they will reduce their social contact. This sadness will affect many other things that they partake in during their life. Feeling useless and unwanted. Many people who suffer from depression believe that they are a burden and that their presence only makes things worse for the people around them. Because of this, like I said before, they will tend to stray away from the people around them and the people who love them, and don't think of them as a burden. Because of this, if anything bad happens to the people around them or their friends, they might blame it on themselves and become overly guilty. Warning: there are sensitive topics. Skip to the topic other. Talk about suicide and self harm. Thoughts of suicide and self harm. When the patient is depressed, they might have thoughts of harming themselves. They might also think about suicide. These are the most dangerous symptoms, but the reason why they think this is because they believe that if they are gone, they might be helping the people that they might have hurt. They think that weight might be lifted from the people that support and take care of them. They also believe that they won't be a burden if they weren't there. There are many other symptoms that one can see from a patient diagnosed with depression. These are: the patient could have trouble with sleeping, meaning that they might have developed insomnia or they had already had insomnia. The patient will also find it much harder to understand simple things. They will also find it harder to concentrate on certain things, like school, for example. The patient might not be able to participate in school activities. What are the common misconceptions? There are many misconceptions when it comes to depression. In fact, in many places, people don't believe in clinical sadness. From what I have collected, I can conclude that many people think that depression is just sadness taken to another level. Many people also think that depression is only to do with sadness and having suicidal thoughts. In fact, I had a few responses that said that the patient doesn't enjoy things, meaning that they are incapable of having fun. Another one of the most common misconceptions that are partially true is the fact that many people believe that people with depression refuse to leave their rooms and are slobs. These are definitely not true. Because of depression, many people do tend to lose the motivation to partake in activities that could even take the smallest amount of effort. This could include things like yoga, showering, brushing teeth, brushing hair, and so on. What are the treatments available? Like all other mental disorders, illnesses mentioned, there are two main treatments. One is to take medication, and the other is to go for therapy. Therapy and talking to others can help the patient feel better, and by letting the patient vent and let out their emotions could help them recover and feel better. Psychotherapy. Psychotherapy is the most common form of therapy that patients with depression go for. Psychotherapy is basically therapy in which the therapist talks to the patient and has meaningful conversations with the patient. Now, one might wonder, what do these conversations even do for the patients? These conversations contain all the problems that the patient has, all the things that the patient talks about but can't. These conversations could essentially help and heal the patients. This is why therapy is so important. Therapy will help the patient develop and feel better. Antidepressants. Antidepressants are more commonly used and prescribed for patients with severe depression. Antidepressants don't always suit the patient. In fact, it usually takes a few tries for a patient to get the right medication. Antidepressants can change the way a patient acts and thinks. Sometimes the antidepressants can have a bad effect on the patient during the trial periods, but with the correct antidepressants, the patient could possibly lead a happy, free life. Usually, when people take antidepressants, it's because they have severe depression. With this, the patient will go for weekly or maybe daily therapy. How can we help a person with depression? Like I have said many times before, the best way to help someone with depression is to be there when they need you the most. Even if it's not in person, you should still be there for the person because you never know when they are going through the lowest point in life. Another good way to help someone with depression is to understand their feelings and help them come out of their depressive state. We can also urge them and help them learn and rebuild their old habits and hobbies. By this I mean we can encourage them to partake in activities that are not strenuous but will boost their serotonin. By doing this, their depression might heal and become better, but we should not force anything upon them, like unnecessary medicines and drugs or physical activities that might harm them or overwork them. The next portion of this episode is dedicated to the interview that I conducted with Ms. Shrradha Sidhwani. In this interview, I will be asking her a range of questions. Her answers will be displayed soon. In this interview, I will be asking the following questions. What is depression? What can cause depression? What are the symptoms and what are the treatments available? What is depression? Depression is a state of the mind where the person is extremely low in mood, which can be suicidal. So the person may have suicidal idealization. There is an aggravated sadness, as we therapists say. Also, it is not only pure sadness. A person who is depressed becomes very dysfunctional in their thinking, so there's a change in the person's routine. So, whatever activities they enjoyed previously, they will not enjoy now. Or if they were socializing before, they would stop socializing. There is a significant change in behavior where you can detect the depression. So, it is a biochemical change in the neurological system in the brain. We have seen in cases of MRI scans and neurological studies that depression is something that is in certain parts of the brain. We also know certain parts of the brain that are responsible for depression. We know certain chemicals in the brain, such as dopamine, serotonin, and imbalance in them, fluctuation in these chemicals could lead to low graded states of depression. What can cause depression? There would be something like nature and nurture. Depression is very highly seen with genes. A genetic depression is very highly seen. So, if there is a family history of depression, there's a high chance of depression. Also, any kind of childhood abuse or trauma could lead to depression, such as any verbal, physical, sexual abuse in childhood. Any kind of other trauma could also lead to depression. Currently, through the pandemic, we have seen that there has been a lot of significant changes in lifestyle. For example, loss of a job, loss of a family member. So, normally, death also has a grieving period, but some people are not able to overcome sudden states of losing a loved one and sort of get into a depressive state. So, that could be another factor of what could cause depression. So, we, psychologists, have seen childhood cases of depression that have stemmed from cases of aggression in the house, bullying in school, or bullying elsewhere by their peers. It could also be children who come from dysfunctional families such as divorce and separation could also undergo depression. They could clearly state that they are not feeling well. They are not able to adjust or adapt to the changes in the environment. Then there are also age related changes. When we talk about the loneliest factor, so age related changes would be, for example, senior citizens who are living alone. And because of the pandemic, we can see that people have been suffering from depression because of the living alone. So that could also be a factor in the causes of depression. What are the symptoms? The symptoms of depression would be one would lose their appetite. You could either lose your sleep or some people excessively sleep. They have constant worries, a constant disappointment, change in weight, either increase or decrease, change in one's sleep pattern, change in your functionality, whether it is working, social functionality, physical functionality, where the person will stop exercising, stop socializing, become passive and withdrawn. So, any behavioral changes will be important to see, and talks or things they say like, I do not want to live or I want to end my life, or even any thought. So, it doesn't have to be that the person has engaged in those behaviors, but even having any thoughts about it. The thoughts would be like, is it worth living this life? Which is known as suicidal idealization. These are signs that the person is not coping well, and these signs would have to be there for more than 2 weeks continuously. It should not be something that we feel today. Like today, because I am feeling low, means that I am depressed. The depressive low phase should last around 2 to 3 weeks, and that is when we detect the person with depression. So, prolonged states of sadness and dysfunctionality. What treatments are available? So, there are multiple treatments for depression. The most widely used are biochemical drugs. These are antidepressants, which have been really researched on and have been advanced currently. We currently have drugs that are very, very effective. People are working and taking the antidepressants so they are able to be functional along with the medicines. Again, CBT or cognitive behavioral therapy, RBT, DBT, mindfulness therapy, these are all areas and treatments where we, therapists, help the patient change their self talk and heal their depressions. Their internal dialogue would be, I don't feel good enough. Their confidence and self esteem would have totally crashed. And I think currently in a socially validated society where everything is very conditional and that we have to be successful, we have to earn so much, have to get fame, a good name, and success, the rates of depression are increasing because constantly people feel not good enough and they judge themselves. So I think that CBT and RBT help the person in a lot of areas like self-acceptance. See, depression can also be there in cases of relationships, in terms of marriage, dysfunctional relationships. These treatments also help the patient accept the other person. The treatments move the expectations to the acceptance of what life really is like and what reality is. And rather than changing others, the treatment can help one change oneself. Another one of the biggest treatments are forms of physical exercise. Things like sports, yoga, working out, and so on. Because physical exercise stimulates certain hormones in the brain, which sort of is like an antidepressant. And we, therapists and patients, use physical exercises as natural antidepressants. And we do encourage patients to exercise as one of the ways of treating depression. We also have support groups where we can have patients talk about and explain their depression because you can learn a lot from another person who has suffered from depression. So there is a lot of sharing happening in the support group meetings. So these are also ways of treating depression. Thank you, Ms. Sidhwani, for your help and professional input.